When you're truly trained in minimally invasive techniques, the laparoscopy is so much less cumbersome and quicker. My passion has always been cancer. Even before I decided to go into medicine, I always had a thing for cancer, and cancer is hit very close to home for me and my husband both, so it was natural for me to seek more training in surgical oncology, so that's really my passion, is that. And then I did minimally invasive fellowship, bariatric fellowship as well. Just, I think the way of the world now is minimally invasive surgery or small incision, and even though small incisions aren't right for everybody, it's probably the best thing if it's possible to do that. Pretty much anywhere from the chin to the hips, so gallbladder disease, cancers, thyroid disease. I mean, a lot of cancers people get through their treatments, and I think a lot of it is emotional support and understanding the comprehensiveness of their care that helps people get through it, and they get on with their life. My approach is really understanding each individual person, what their motivations are for coming to see me, and then what is their daily life like? What are their histories? I think a patient can expect first to be treated professionally, be treated with respect, be treated with kindness. They can expect to have somebody who's going to listen to them, listen to their needs, understand what their expectations are. Family can expect that themselves or their family member would be treated how they would want to be treated. I think the other thing that's important is talking to not just the patient, but their primary care physicians or anybody else involved in their care, so that everybody is together on what the best treatment plan is. Every person here that you encounter, from the phone call to the walking in the door to seeing myself or Dr. Ng, is going to do the best they can to help you and do anything we can to get you back to where you want to be. In the shuffle of the way things are now, and the way you're being pushed to see more patients and by different entities, the time restrictions that we're now faced with, it's very easy or almost necessary for a lot of physicians. It's almost turned into a factory and moving patients along quickly, and I think one thing I can be proud of is I'm not concerned with that at all. Just take my time and do things the right way. I think the most important thing is that you're not walking away with one thing. Any one of those things, whether it be the equipment, the technical skills, the personal care of patients, any one of those things alone doesn't make for good care. I think you have to have all of those things together in order to provide appropriate care for somebody.